Good morning, guys.
Good morning.
Okay, how is everything going? Good?
Good.
Good. Okay. Okay, guys. Now, so far, any questions?
No.
No, everything is clear so far?
I have one question.
Go ahead, yeah.
On the bright space, it shows like a PowerPoint kind of. Are we supposed to use that for anything?
No, it's pretty much okay. You got your book. That's the best tool, my dear.
Okay.
Okay. You're gonna say it's okay. Because it's mainly as okay, just a PowerPoint, that's okay. Taken from the book, if you want to put it that way.
So it's like the same thing you're doing with us.
Pretty much.
Okay.
Okay. Okay. But it's not me who made those PowerPoints. And I would say there's some mistakes in the PowerPoint. It's for me, it's okay, just it's PowerPoint for the book, but just use the book, my dear. Okay. Good. Okay. Now, okay, guys. So, just one last word for edge. Which is history. Now, some of you may have heard of this.
Hysterectomy.
No, not hysterectomy.
Hysteria.
Yeah. What is that?
Is that like when you are feeling crazy?
Or you can say freaked out.
Freaked out. Yeah, like overly anxious.
Okay. Overreacting, right? If you're overly anxious, you're overreacting.
Correct. Yeah.
Good. Now, guys, okay, as you will see, I already told you, anything that ends with an IA means yes, okay, becomes a condition. Now, but the word history as here means uterus. So but what they probably as okay thought once they first saw the uterus was they thought that they found the reason for hysteria. Yes. So okay. But that's okay, guys. The word hister actually that's okay means, or in this case, it will mean the uterus. And that's why we can go and say it's okay, hister, ek, .
So hysteria just means uterus condition?
No,
Okay.
but okay, listen. What they mainly as okay might have done was okay as when they found the uterus, they say, aha, now we found the reason for the hysteria.
Oh, okay. Okay.
Okay, and that's a sick joke. And that was something that I heard from a professor in California who actually is okay uh, a neuroscientist. But okay, yes, was conducting a very similar course like this one here. And when she got to history, which is okay as now we know as the uterus, but the first term that she brought was okay as hysteria, and she said that explains it. So that came from a woman, not from me. Okay, now yes, okay, he says okay, hysterectomy, and what I said yesterday was okay as ectomy as a whole, yes, okay, will mean yes, okay, just mean we can say okay, removal of. Okay, but if you actually just okay, break the word ectomy up, now we can mean this as okay, the Y here mean is okay, makes this whole term here is okay. The Y itself is okay, makes it a procedure or process, just like we said, scopy became yes, okay, the procedure of using a scope to visualize. Okay, just like we say, graphy becomes yes, okay, a procedure of yes, okay, recording. Likewise, when we say show me, that becomes a procedure of, we can say it's okay, cutting into. And where the word ek here actually is okay came from act. But you can mean says okay, they might just have taken off one of the cheeks. Clear? Whereas okay, this act here, act actually is okay, was from ext. It just become x, which means out. So cutting out of the uterus. And when you cut out the uterus, you mean yes, okay, well, remove it. Okay. So as a whole, yes, okay, the word ectomy means removal of. Removal of what? That's okay, whatever structure you have as the root word here. Okay. But otherwise, is okay for the uterus. Well, okay, they still use as okay the word uterus as a medical term as well. Where you mean is okay, you can say it's okay. Uterus is okay. You can say it's okay will become uterine, which means is okay, where this means is going to be pertaining to, and again, it's the uterus. Okay. Any questions?
No.
Good. So whenever you see the word ectomy, yes, okay, actual meaning for that was just going to be removal of. But if you look into it, because later on, yes, okay, we will talk as tromy as a suffix, and tromy as a suffix will just simply mean cutting into. Okay, where this ek here actually is okay was derived from act, which is okay as derived from ext, which for me is okay mean out or outer. Okay, guys, let's try to carry on. Now our next term is going to be yes, okay, la part. And of course, that's okay. If required, that's okay. We may have it's okay working corner combining vowel, which will be an O. Now, guys, la par is mainly as okay, just another term for abdomen. Clear? And what's the abdomen? That's mainly as okay because it's okay the region between the chest and pelvis. That's what we call the abdomen. Okay, we will talk more about yes, okay, the contents of the abdomen and so on, so in the next chapter. And okay, start to name them. Okay, so anatomically speaking, yes, okay, we call the region yes, okay, abdomen. But another term that can be yes, okay, referring to the abdomen is going to be lapar. Now, mainly as okay, just two terms here. We can say as okay, first of all, lapar. Oh, and here we come. Chomi. Okay. Now we already said that okay, chomi means cutting into. Okay, O here is made as okay, just a combining vowel between yes, okay, lapar and chomi. Where the word lapar actually just means abdomen. Okay. Now, when we as okay say cutting into, how do we cut into something? Mainly as okay by incision. But okay, the word scission here, C-I, okay, sorry, maybe I should write that a little bit clearer. Incision, now where the word scission here mainly means cutting. And the word in is into. Okay, so an incision to the abdomen can also be called laparotomy. Because what you actually are doing when you do a laparotomy is that you cut into the abdomen. Okay. Now, yes, okay. You may see, yes, okay, in your book on figure, it's okay, 1.7 and figure A. That's a belly button. You may, yes, okay, see, yes, okay, a big incision like this. Well, okay, in this case, yes, okay, it is stapled. But that is mainly as okay, how we can say it's okay that a laparotomy had been performed. Okay, now this kind of incision here, of a laparotomy incision, is going to be as okay called a mid-sagittal laparotomy. Okay, now what the mid-sagittal means was okay, that's something we talk more about in the next chapter. But it's made as okay, there's going to be as okay the plane in which the incision was made to open up the abdomen. Is that clear?
Yes.
Okay. Now there are yes, okay, different kind of okay, yes, laparotomy incisions that could be made, and okay, yes, they may go under different names. But yes, okay, any bigger or smaller, yes, okay, you can say it's okay, cutting into the abdomen, and mainly yes, okay, opening up the abdomen will be referred to as a laparotomy. Nowadays, guys, unless and until necessary, many procedures that may be performed on the abdomen, but they try not to perform a laparotomy. Is that clear? Why? Because a smaller or big, a big incision like this one here, for instance, they probably would not do that anymore unless necessary. Clear? Okay. Smaller incisions like as the gridiron incision. That's what they call it, Morphy's incision, so on. So that's they may still have to do it. Okay, and that's why. Why? Mainly because what they commonly do nowadays is more like what we can call it a laparoscopy. Again, yes, the laparoscopy, yes, means abdomen, yes, the O is still, yes, you're combining vowel. But instead of, yes, make a big incision, like this one here, for instance. Or, yes, even this one here. What they may do is, actually, it's just make 2-3 small holes, and through one of those holes, actually, it's use a scope. And that's what you see in figure 17 or 1.7 B. Where, for instance, we may have, yes, we can say, the same abdomen. Okay. We still have, as the same abdomen. But yes, where the main, yes, we'll just make one incision or small puncture hole. Through that puncture hole, yes, they put in a scope. And most likely, yes, through, yes, two or in most instances, it's going to be two. In rare instances, maybe even, yes, a third puncture hole through which, yes, surgical tools are, yes, inserted via ports. And, yes, whatever surgery or procedure is performed under the direct vision of the scope. Okay. But yes, when they use a scope to, yes, either perform procedures on the abdomen or, yes, mean, yes, just to go into, yes, look on the inside, that would be, yes, laparoscopy. Did that make any sense?
Yeah.
Yes.
Okay. In some cases, they may start off as a laparoscopy, but God forbid, something goes wrong and so on, so. Or as maybe that's because the procedure that they try to perform scopically may not be possible to perform as under the scope. They may have to then go and change it into a you can say a laparotomy. Where they most likely then would check out the scope, the tools, and yes, go the traditional way. Is that clear? So laparotomy is mainly as we can say as the old fashion of as cutting into the abdomen. Okay, now we use the word tomy. Now tomy as we mainly will see is going to be as a procedure of cutting into Okay, which is also can be referred to as incision. Where the word scission, C-I-S-I-O-N, is the same as cutting. And here the word in is to just the into. Whereas if we take it the other way and say, yes, let's go and say, okay. I'm just going to break it up. Excision. Now here's this scission still means just cutting. But then the word X means out. So excision mainly as is going to mean as cutting out, which is going to be the same as anectomy.
So it's the same thing as a removal?
Exactly.
Okay.
Because you excise something, you cut something out. Did that make sense?
Yes.
Okay, so that's why I say it's this ec here in your ectomy actually is derived from X, which means out. And chomi is the same as cutting. Or chomi and scission both means cutting. So when you say ectomy, that is mean as just going to be the same as excision. Whereas incision is going to be as that first cut that you apply. Not you, but just anybody who has just cut into the patient. The first thing that they do is that they apply an incision. Clear? That first cut or whatsoever, that's going to be an incision. It just means incision just means cutting, and in is yes, cutting in. Clear? And after that goes just excising. Removal the stuff. Cutting it out. Which we also can call ectomy. Because chomi is just another word for cutting. And ec is the same as ext. X out. So cutting out. My dear, you're not going to be able to continue. Excise. I say, God forbid. Okay, I don't intend to have those conversations with any of you guys, okay? But any questions? So some of you may say, why didn't they use the word abdomen? Yes, maybe yes, for chomi and scopy. Maybe because it doesn't sound that sexy. To say even not I'm able to pronounce it, right? Okay. So it's easy to just let's just use the word lapar. Okay. Where you can say as far as the term abdomen is used, it's more as to name the area. Right, okay. So laparoscopy versus laparotomy. Okay, and you see two nice pictures of them both on your book on figure 7 1.7.
Is he frozen for you guys?
Yeah, I don't know. That's
I just wanted to make sure it wasn't me.
okay. Okay. Okay, are we still frozen? Ah, okay.
No, you're good now.
If you guys are moving, you are not frozen. Okay. Okay, guys. Okay, let's continue. Now, Luke, L-E-U-K. And Luke, L-E-U-K means white. Now, they may use, that's okay, in some instances, okay, if we need to, a combining vowel, which is going to be O. And let's just, well, now we already talked about it. We can do it this way. We can say Luke is white. In this case, yes, okay, we will use as okay our combining vowel, which is O. And then we, yes, okay, just take the suffix, which in this case here will be site. So that became just okay, the white cells. Now, guys, whenever you use the word or term leukocyte, it's going to be as okay what we call the white blood cells. Okay. Now, guys, when we talk about, or when we're going to just okay, talk in detail about blood in chapter, I think it's chapter 11, in your anatomy physiology. We will then talk about yes, okay, the different subtypes of white blood cells, etc., at that time. Okay, but generally speaking, yes, okay, what we call is okay the white blood cells. Technically, yes, okay, in anatomical terms, are going to be referred to as the leukocytes. Where leuc mainly is okay, just means white, and cyte is cell. Now, another word of yes, okay, where we talk about leuc is going to be, it's okay. And again, it's okay here, we will use our combining vowel. Okay. Yeah, okay, guys. What we still here is okay, mean by is okay, the leuc is still going to is okay, be is okay, pertaining to is okay, the white blood cells. Okay. But here is okay, now we make just okay, just do it this way, and you can see site is still going to is okay, be is okay, referring to the cells. Now here you will actually has okay, how and other suffix, which is going to be osis. Okay, where I mainly as okay, just will break this up now and say as okay, the cis here mainly as okay, going to mean that it's going to be as okay, and then we just okay, state, or which you also can call it okay, a condition. And what the O is in this instance here refers to as okay, abnormal. So what we have is going to be, okay, what is going to be called leukocytosis. Yeah, okay, as a whole, we can mean that's okay, there's osis here. It's okay, becomes okay as an abnormal state, or we can say okay, an abnormal condition. In this case, it's okay, involving the white blood cells. Okay, I just want to make sure that we aren't frozen. Okay. Now, guys, some of you will say, okay, so when do we have this leukocytosis? Okay, when is it that leukocytosis, yes, okay, may occur? Because what we mean is, okay, having leukocytosis is going to be, and here it goes, guys, because it's okay, it's going to be, it's okay, an abnormal increase. Oh my God. In the, we can say, okay, number, or if somebody doesn't like the word number, yes, okay, we can say count of the white blood cells. So one thing that we have in, okay, as in a case of leukocytosis is that there's going to be an abnormally increase in the number of the white blood cells. Generally, as okay, that's what they will call a leukocytosis. Okay. But it is not that abnormal because, okay, what mainly is okay, will cause is okay, a person to have leukocytosis is going to be, okay, is going to be due to an infection. In most instances. We may even go and say, okay, even as okay, in case of an inflammation. So in case of an infection and or inflammation, one of the primary things that just okay will happen is that okay, yes, the amount of red blood, not red blood, amount of white blood cells is going to increase. And that increase in the white blood cells, sorry, is going to be referred to as leukocytosis. But this increase of the number of white blood cells that we call leukocytosis mostly is just okay due to either an infection that the body is going to try to fight, or just okay in case of inflammations. Did that make sense?
Yes.
Yes.
Okay. So that's when you, for instance, okay, if you, for instance, have a bad fever or something like that, okay, that they may say, okay, check a blood test, and they may say, okay, well, okay, the white blood cells are high. Okay, usually the normal count is okay, is up to 5,000. Between 5 to 10,000. If it goes beyond 10,000, that's okay. That is considered to be leukocytosis. Okay. So it means, yes, okay, there's going to be an abnormal increase of, yes, okay, the white blood cells count. Okay. Mainly because at this phase here, okay, what is that your body is just trying to do? Either fighting an infection or, yes, okay, is okay, try to manage, okay, as an inflammation. Okay. But the thing here is that, okay, yes, is just going to be, yes, okay, an abnormal increase in the number. But guys, please keep in mind that, okay, these white blood cells here, they're going to be normal white blood cells. Or we can say, is okay, actually, it's okay, functional. because we now just going to yes, okay, talk of okay as another scenario in which yes, okay, there will be yes, okay, a further increase in the white blood cells count, or whether white blood cells are going to be abnormal. What do we call that condition? And we are going to just okay say, well, okay, Luke is still yes, okay, still means white. Clear. But then we have as okay the word M or EM, which mainly is okay. The word M here mainly is okay would just mean blood. Just a segment here. And okay, yes, the last part of the word here is going to be ER. Mainly is okay when you say E, that mainly is okay indicates that okay, this whole term here is a condition. Yes. Angeline, you had a question there?
No, that's what I was gonna say.
Clear? So what is it that we now have? We have the word leukemia. Okay. The E main indicator, okay, this whole word here is a condition. What kind of condition is going to be a blood condition? So mainly as okay, if you mainly as okay, just put M and E together. What that actually is okay as a whole will mean is going to be a blood condition. Okay. Every blood condition will end with emia. And what we mainly says, okay, in leukemia here, that it's going to just, okay, involve your white blood cells. Now, what's going to be is okay. Now, if you look at the first thing that we say is okay about leukemia is that it's going to be is okay. We can say it's okay an abnormal increase in the white blood cells number. And as I said, it's okay if you're going to like the word number, you can say count. So you may say, well, isn't that the same as what we had in leukocytosis? But here is okay, this is going to be different. Because, okay, these white blood cells here, which count has increased, are not normal, but they are cancerous. So what leukemia is actually as okay, it actually becomes a type of blood cancer. What type of blood cancer? In which, okay, yes, that's going to just, okay, involve the white blood cells or the leukocytes are cancerous. And not only are they cancerous, but they're actually just okay. There's going to be okay an abnormal an abnormal increase in the number of the white blood cells. Okay. So if you said, for instance, okay, in leukocytosis, the range was between, yes, okay, 10,000 to, that's okay, yes, 12,000. In leukemia, yes, okay, the count is going to be anything between, yes, okay, 15,000 and above. There's no upper count. Now, in some, yes, okay, very severe, yes, okay, fevers and so on, so on. So your white blood cell may be at this high. But the thing is, okay, yes, you will not be able to treat or settle down the fever with antibiotics and things like that. Another, yes, okay, unfortunately, yes, okay, ringing bell or red flag was that, okay, as if a patient comes back with recurrent infections that you treat, and okay, as he or she may be good for maybe a couple of weeks and then it comes back. Then you may say, okay, it's probably not the infection that causes him or her to have these recurrent episodes of fevers. There may be something else. Okay. So leukemia is mainly as okay, it's just going to be a type of blood cancer, which mainly is okay involves your white blood cells. And what's going to happen? Well, okay, as the number of white blood cells is going to be far, 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 far higher than normal. And that's why it's okay, the patient still has okay that feeling of a fear or fighting an infection or something like that. Clear? Okay. But the thing here is that okay, as these white blood cells here are not going to be normal. They are cancerous. So that's the main difference between leukocytosis and leukemia. That in leukemia, as okay, there's going to be an increase in cancerous cells. Whereas in leukocytosis, well, okay, it is abnormal because you're not ideally not supposed to have an infection on a daily basis. Okay. Is there going to be an abnormal, yes, okay, increase in the number of the white blood cells? But it is normal in the sense that, okay, it is there to just, okay, fight off an infection. Did that make sense? Okay. And please keep in mind your cancerous cells, and we'll talk about that later. Cancerous cells are not normally functioning. Clear? Okay. So you can't say, okay, more white blood cells. Yeah, even better to fight off. That's okay. Infection, inflammation, take care of okay the body's immune system and so on. So no, because they are not able to perform the job. Just think of it. You may say, well, okay, as more firefighters or police on the streets, well, okay, yes, not necessarily, because if those firefighters don't know how to, yes, okay, turn off a fire, they may be more trouble than good, right? Okay, so so please, 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 that's okay, make sure that you know the difference between leukocytosis versus leukemia. And as I said, it's okay, whenever you see the word emia, that will be as okay a blood condition, because M means blood, E condition. Clear? Okay. We will take okay some crazy examples up about okay some emias later on. Okay. And okay, as a other suffix, which is going to be osis. Now the cis means just means that this is a state or condition process. where the O here is not going to be as okay a combining vowel. But O mainly as okay, along with that cis makes it an abnormal procedure. Or just like, okay, you do something, oopsie, you say, oh, oh, what did I do? Okay, so that O is mainly as okay, you did something which was not supposed to be done, which was not a normal action.
I have a question about the suffix cis.
Cis,
Yeah, so when we were talking about it yesterday, like in diagnose, you said that the cis meant procedure or process.
Mhm.
So I'm just a little confused on,
well, you can say it's okay, the process of diagnosing.
right,
Okay. But you can also put it this way that, okay, yes, what you get at the end is going to be as okay a diagnosis.
right. So it's just kind of like,
Both.
kind of has like a similar meaning. You just have to make it make sense in the.
Exactly.
Okay.
Like you can say it's okay in the context, yes, okay, the remaining text.
Okay.
Because you can say it's okay. When you, for instance, okay, was okay as a part of okay the clinical exam and so on and so. Or as okay procedure, the whole point is that you want to diagnose.
Mhm.
Clear? Okay. Right. But that process as itself is also known as a diagnosis.
Right. So then when like sorry, I'm just going back. So like cystolithiasis,
How
you
many?
refer to that as a process, cystolithiasis. So instead of calling that a process, could you just say it's a condition of bladder stones?
No, lithiasis. That is not,
Oh, yeah, sorry.
that's with an E.
Right.
It's when I say OSIS, OSIS. Okay. That becomes just okay, abnormal process or an abnormal condition.
Okay.
Okay.
All right. Thank you.
No problem. Yeah. Whereas, okay, when you say it's okay, nephrolithiasis, or it's okay, cystolithiasis. Okay. Now the cis here is okay, still me, it's okay, that it becomes that okay, that this whole thing here is because it's like a process of procedure. Where we can mean it says, okay, now the word lit, also lit, sorry. Lit means stone. Okay. Now, it may not be correct to say it this way, but you can say, okay, this will just become as okay, the formation.
Okay.
Okay. Or the mean is okay, just put that into as okay, make it as okay, easy to pronounce. Okay. But whenever you see as okay, the word cis at an end, there's no question about it. It's going to be as okay, either a procedure or a process. Clear? Where okay says okay, when you then says okay, oh cis. Now cis is still just okay, a procedure, a process, but what that O here does, it makes this become just okay, an abnormal procedure, an abnormal process.
Okay, that makes sense.
Okay.
Yeah.
What? Well, okay, yes. The other juicy details that you have here. Okay. Let's just look at the next word, and you can see some other SOK is here. And the next word is never. Now, again, SOK, this may be SOK combined with SOK combining vowel, which would be O. But that's only SOK if it is required to do so. Now, the word never means kidney. Now, guys, there's going to be another word that also means kidney, and that is going to be REN. REN also means kidney. So in some instances, okay, they will use the word never to represent kidney. In some cases, okay, they will use the word REN to represent kidney. Now, since you right now are never, yes, okay, we can say never was kidney. An example would be, or we can say, okay, the first term that we will be using is going to be, okay, what we call never on. Okay, which mainly become, yes, okay, what we actually, yes, okay, just refer to as a nephron. Now, guys, what a nephron is going to be, that's going to be, yes, okay, we can say there's going to be basic functional unit of the kidney. So I hope both of you have two kidneys, right? Okay. Now what each kidney is going to be made up of. Each kidney has approximately, okay, 1 million nephrons. Okay. Which are going to be as okay individual as okay filtering stations. That's going to filter your blood out from it's okay from waste. So it's actually as okay the nephrons that does the job of the kidneys. It's just that these is okay approximately is okay 1 million nephrons are put together into as okay one structure which is called a kidney. When usually it's okay when we talk about it's okay the kidney as a whole, it's okay we may use as okay the word REN, and that's what we can say is okay. For instance, renal. L is just okay as pertaining to, and N here is your kidney. So meaning it's okay pertaining to this whole thing here is going to refer to as renal. Clear? So something is okay actually is okay goes under two names. Kidney is one of them. But the question then is, okay, as when do we use nephron? When do we use REN to represent kidney? Well, okay, it just have to sound right. We can just take an example and say, it's okay, if you go and for instance, okay, say nephron. Next one will be as okay, ectomy, which we I now know means that's okay, word mean. Rem removal. Removal of what? The kidney. Now, somebody will say, okay, why don't they use the word rent? Okay, maybe it doesn't sound that chic as nephrectomy, renectomy. Okay, but I think, okay, as they agreed upon, this sounds more. Yeah, okay. Suitable. Now, again, yes, okay, we can say, yes, okay, never. And here is okay, just add our other word, which is going to be as okay, oosis. But when you see this cis, oh, sorry. When you see the cis here, it's okay, you should say, okay, this is okay, most likely as okay, a condition or process or state. But it's okay, where this O here, my dear, is not a combining vowel, but it actually is okay, just make this whole word here is okay, an abnormal state of what? Of your kidney. Did that make sense?
Sorry, that one's an abnormal kidney condition.
Pretty much.
Okay.
Okay. And then we can just, okay, just add, we can just, okay, different, yes, okay, other ruled words in front of the nephroses to specify it. Now, what is it that actually is okay, is abnormal or causing, yes, okay, this abnormal, yes, okay, state of kidney. Or abnormal, yes, okay, kidney condition here. A term that you guys may see is going to be as okay, glomerular. Now, some of you will say, okay, what the heck is that? Now, guys, right now, okay, you can say, okay, the ul part here is pertaining to. Here is, okay, this O is a combining vowel between glomerular and nepher. And the gloomer, if that's what you want to call it. Now, this is actually, that's okay, just a part of the nephron, which was, okay, the basic filtering unit of your kidney. So mainly it's okay, what happens in what you can call as glomerulonephrosis is that, okay, there's some hanky-panky going on in one part of the nephron, which we'll call as, okay, the glomerulus, that leads to an abnormal condition of your kidneys. But the trouble lies here. Okay, but as a whole, yes, okay, what does it eventually lead to? Yes, okay, an abnormal condition of the kidney. but where the trouble lies in the glomerulus. Another state, and that's okay. My main point here is okay, just to introduce, you can say it's okay, another suffix together with that's okay of our with our nephro. And we still say it's okay, oosis. But the meaning of these two here doesn't change. It's eventually it's okay, just going to it's okay B. That we say it's okay, an abnormal state or yes, okay, condition of your kidney. But what happens here? We're going to has okay, put another suffix, sorry, another, this actually is okay, will be a prefix, which is going to be hydro. And when we say hydro or hydro, and we just say it's okay, the O here is okay, just a combining vowel between the hydro and nephro. Where this hydro here or hydro means fluid. So hydronephrosis is still going to be as okay, an abnormal state or condition involving the kidneys. But what mainly happens is that okay, yes, what is abnormal about it? That the kidney actually is okay, accumulates huge amounts of fluids. Okay, and okay, so that's okay. What the word hydro here mainly means is okay, is referring to fluids. And what's going to happen as a result of hydronephrosis? We can say it's okay, the normal size of the kidney was this much. Now, due to whatever reason, fluid, most likely as okay, fluid that okay, yes, was supposed, yes, okay, had got excreted in the form of urine, isn't able to, yes, okay, leave the kidney. Starts to, yes, okay, accumulate in the kidney. And the kidney mainly is okay, just swells up due to, yes, okay, accumulation of fluid in the kidney. Now you actually, as okay, will end up with okay, as well an enlargement due to, yes, okay, an enlargement of your kidney, or where that enlargement is mainly as okay due to, yes, okay, accumulation of fluid in the kidney. So yes, okay, that accumulation of fluid in the kidney is going to be referred to as hydronephrosis. Whereas generally speaking, yes, okay, girls or guys, sorry, probably yes, okay, may say as okay, will be as okay, enlarged kidney itself is going to as okay be known under, it's going to be going under the term. And this is where we actually okay, go and say the kidney now is going to say, okay, we use the word ren. We will have, okay, as a combining vowel, which is going to be O. And okay, yes. So yes, okay, the ren is going to be, yes, okay, what in this case is a way, yes, okay, represent kidney. And that's okay, an enlargement or enlarged is going to be megaly. Okay, where renomegaly is mainly just going to be as okay, what you will call enlargement of the kidney. If you have an enlarged kidney that is directly going to be straight, it's going to be okay. Renomegaly. One of the reasons for renomegaly can be it's okay hydronephrosis. Because okay, the kidney main is okay just enlarged because of accumulating fluid. Did that make sense? Or you can say it's okay, the normal size of a normal person's normal kidney is this much. Or half of his hand. Or just as okay, the palm. Now what about a giant? Now a giant is probably also going to have a hand that is bigger than a normal person, right? So humongous kidney. Is that a Great Dane?
Yep.
Oh, they are beauties.
Yeah.
I always wanted one like that.
Yeah. It's a great dog.
Okay, yeah. Scooby-Doo. Okay, okay, okay. Bias, okay. But generally speaking, it's okay when you say it's okay in large kidney, that will be renomegaly. Clear? Where you can say it's okay if the kidney, yes, okay, is accumulating fluid in it that will become hydronephrosis. Okay. Now, one of the common reasons why it's okay, a kidney is okay may become enlarged or renomegalic due to hydronephrosis is, just look at it in this way, guys. Sorry. This is your kidney. It is continuously, as okay, supposed to produce urine. And what we know is that that urine is going to, as okay, leave the kidney. Right. Ooh, that's okay. It passes, then it goes to, yes, okay, we can say it's okay though. Ladder, and okay, from there it goes out. Now, for instance, if there is a stone here that blocks the traffic, this kidney is still going to, okay, still try to produce urine. It doesn't go anywhere because the road is blocked. The traffic jam just accumulates. Not just only stones, that's okay. Even if yes, okay, chuck the stone away. Oops, sorry. Even if you chuck the stone away and say, okay, there's no stone. But it's okay if you had a tumor right next here to the ureter, for instance, that pressed up against the ureter and blocked it. The same would happen. Okay. You can even have, okay, it's okay, you can even have, okay, it's a stricture in the ureter. So that's okay, that can be, it's okay, a whole lot of reasons. You can have a stricture here, or maybe the stone is stuck here. Whatever reason. But it's okay, you end up with hydronephrosis. nephrosis. And at some point, it's okay, that kidney is going to say, well, okay, bye-bye, I can't function more like that. Did you guys get that?
Yes.
Okay, so hydronephrosis, an abnormal state of the kidney, which causes or which is due to accumulation of fluid. Clear? Okay. Where does the fluid part come in? Hydro. Okay. Whereas renomegalia, that's where we go from nephro to renal, to represent kidney, becomes enlargement of the kidney. Now, please don't say that, okay, Mike told us once that, okay, yes, hydronephrosis is the only reason for renomegaly. There can be a whole bunch of other reasons. Right? But yes, okay, what you make or what you get in hydronephrosis is, okay, yes, an enlargement of the kidney. Now, guys, it only is okay is a matter of okay as changing one word letter. And okay, as the whole meaning is okay, changes. Okay, because okay, what we just had was never. Our new word is going to be as okay, neural. Maybe again can say as okay, now we may have okay as a combining vowel, which would be O. But it's okay, we said that never meant kidney. Now neural is going to be nerve. Now in nephro, guys, we just said that as well, that we had okay something that we call nephron. When using neural, we have something that we call neuron. When neuron is mean, it's okay, just another fancy word for okay, what we can call a nerve cell. Okay. And I say that because it's okay, guys, it's mainly it's okay, just a matter of this changing out this, which okay makes a whole difference. Okay. Now, one of the main departments that I used to work in was neurology. Well, okay, yes. Okay, yes, they say nerves, but okay, you can also check like what makes up your nerve or what is made up of your nerves. Is going to be your brain, your spinal cord, and then you have okay the nerves of the body. So it's okay the study of diseases involving yes okay your nerves or anything that is made up of nerves, and the treatment and so on so is going to come under neurology. And let me be honest, yes, okay. The biggest chunk of them, yes, okay, were yes, okay, conditions of the brain. Because okay, tons and tons and tons of patients of strokes. Approximately 75% of OKS or departments were filled with people who had suffered from strokes. Now, another word, for instance, goes is going to, okay, sorry. Let me just do this. It's going to be, it's okay. Neuritis. Now, pretty much, okay, it's a very vague term. Okay, because, okay, nerve means, or neuro means nerve. And itis means, it's okay, just means, it's okay, inflammation. Right. So not really a term that you will be seeing used a lot. There's another vague term, but my whole thing is okay. Is that I just want you. Okay, no, let's do it this way. It's going to be nerve or neuro. Sorry. Let me make it up and break it up in colors so we have it. Neuro is going to be nerve. Here we have is okay. O as our combining vowel. And patty. Pair guys. And again, we can say it's okay. The Y here is okay means process or condition or state. Where the word path doesn't mean it's okay that you take a path that leads you to okay as your destination. But the word path here actually is okay means disease. So neuropathy is mainly as okay, just a broad term. That mainly is okay, just puts us okay, a lot of okay as nerve conditions that's okay into the same box, referred to as neuropathy. Okay. And okay, guys, but this neuropathy here is actually is okay one of the complications of diabetes, or what some people call is okay sugar, or diabetes mellitus. Where what mainly is okay happens in this kind of neuropathy is that okay the patient actually is okay loses his sense of sensation. So they're not going to be able to feel much. That's why it's okay. They may have, okay, as a little piece of stone or rock in the shoe that they are stepping on. They don't know about it because they don't feel it. And before they know it's okay, they get a wound. And before they know it's okay, that wound get infected. And before they know it's okay that that wound is infected, it is badly infected. So that's why it's okay. There's a phenomena that is called diabetic foot. Some of you may have heard about it. And some of you will say, okay, why not soccer player foot? Why not gymnast foot? Why not that foot? Why diabetic? Because yes, it's human nature. You say, okay, no news is good news. I don't feel anything. Okay, that's probably nothing wrong, and they don't know that okay, as disaster is developing. So yes, okay, one of the primary reasons for that is okay, what we call is okay, neuropathy. But again, I say it's okay, neuropathy. It's a vague term right now because okay, there's a lot of things with this okay, it's neuropathy. But okay, to find the actual cause for that neuropathy because it's not only going to be diabetes. That could be otherwise okay, much more difficult forms of neuropathy to find the cause for than diabetes. Okay. No, I remember, and okay, that was yeah, okay, when I was younger, very younger. I think at that time it's okay. I was in second grade, so that's many years ago. I don't think any of you were born at that time when I was in second grade. Um, but we were actually as okay. Well, okay, we went to okay, as you can say, as a summer camp. Mainly as okay, just a vacationing center. Not center, but it's okay, vacation outing with okay as other school children for a week or so. And it was out in the country, so it's okay by the boarding house where we were living at that time was fields. There is okay, cows and goats and sheep will graze, but that was enclosed by an electric fence. Now, have any of you ever been caught by an electric fence? Okay, well, it's probably not going to kill you, but it's going to give. It's okay, huh? It's okay, an electric shock, just so that you won't get any closer. Now, and in that group of, it's okay. I can't say it's okay. Other guys that we had in that group was okay. As a guy who actually, it's okay, had neuropathy, so he could actually grab onto that electric wire there and not sensing that he was getting shocked. So what some people try to us okay used to do was okay when we were walking by those fields they would push him. They were bullies, so they would push him on that thing. And okay, well he couldn't feel anything, so he didn't. He just thought okay they were just playing. But the thing was that okay when somebody tried to it's okay to help him get up, what happens? If you're touching somebody who is getting electrocuted, you are
You get electrocuted too. You
yeah.
turn
So
into
that
that
person who
current.
you're gonna go, shit. What the hell was what the hell is that? Right? Okay. Okay. So yeah. So mm, no, he couldn't feel much. Okay, not feel much. He couldn't even feel it because it's okay of some sort of okay of neuropathy. So okay, guys, just take a short break and should I say I see you guys back at 10:40? Okay. Okay, guys, welcome back. Um, any questions?
Nope.
No. Okay. Good. So let's see. Now, on or on proof. All right. And we already, as okay, briefly, as okay, talked about this term here when we did Carson, because they both meant cancer. Okay. And now we can mainly say, as okay, if we go on logy, where okay, the word logy is going to be okay, again the study of. And what is it we study is okay, it means it's okay, going to be it's okay. Disease and treatment of onco, in this case here, which is cancer. We could also say that, okay, yes, if that was the case, then okay, we have somebody who will be, yes, okay, considered as an oncologist, which means, okay, will just be as okay. Because it's okay, a specialist in, as okay, disease and treatment of cancer. We also said that there was something that we call an onco gene. Where it says, okay, it's okay, a gene is mean it's okay, there's going to be it's okay. It says, okay, genetic effect that leads to cancer. And in all these cases, okay, the O mean yes, okay, just was a combining vowel. Right. Did you guys get that?
Yes.
Everybody.
Yes.
Yeah.
So as okay, oncology, that's going to be as okay, the specialty or the study of cancer. Okay, they don't call it cancerology. You're not going to see as okay a word as cancerology. Okay, now we can just say as okay as far as okay as the treatment. Just okay, yes. If we talk, for instance, okay, of the treatment of cancers. Okay. Well, okay, there are mainly okay 2-3 major forms of treatment. Of me is okay 2, and one is okay we use drugs. And the other, they may use as okay what we can call radiations. Now, guys, if they use drugs to treat, that is what they will call chemotherapy. But the word therapy mainly it's okay just for me. Treatment, and where the word chemo maybe it's okay come from chemistry or chemicals. And that's pretty much okay as what your drugs are. So chemotherapy, that's mainly it's okay when they treat cancers with help of drugs or medications. Whereas, okay, if they use radiations, that's what they will call radio. And okay, me is okay, says okay, the O is going to be as okay, combining vowel therapy. And this therapy is telling me that's okay, treatment, but where that's okay, they use radi. Yes, okay, the word radi actually that's okay comes from radiations. And O in this instance, yes, okay, just is your combining vowel. Is that clear?
Yes.
Good. Any questions?
No.
Good, everybody. Now, ophthalm. What a word. What that means is okay, just means is eye. Now, guys, there is another word that also means eye or represents eye. And that is going to be opt. The word opt also, yes, okay, means eye. We can, for instance, yes, okay, say, yes, okay, such a thing such as opt ick. Mainly, yes, okay, just becomes, yes, okay, pertaining to the eye. Now, the same is going to be, yes, okay, for ophthalm. And okay, yes, that is also going to, yes, okay, be followed by ick, which becomes, yes, okay, pertaining to the eye. Okay, so both of these here, that's okay, just means that's okay, pertaining to the eye in their own. We can say it's okay, capacity. Now, let's just look at the word ophthalm. So please just okay, the word opt, O-P-T. Let me just write it here. Also means eye. Now we can, for instance, say, yes, okay. Down. O, which means, okay, just a combined vowel, and we can go scope. Okay, so this is going to be, okay, a tool to visualize. Mainly, it's okay, what they want to visualize with the help of an ophthalmoscope is the inside of the eyeball. Or maybe it's okay, just a tool or a scope that's going to, is okay, used to be visualizing the eyeball is going to be called an ophthalmoscope. Now we can say, it's okay, the procedure when we use an ophthalmoscope is going to be, as okay, scopy. Or we can say, it's okay, ophthalmoscopy. Now, we also have a condition or a phenomena. Now you may see a picture of that in chapter number 4. But we can just okay talk about it here. And we actually just okay call it X. It's okay as although it's okay the word X means out. But then we use actually as our word ophthalm, which means eye. Followed by ear. We just call it, okay, this whole thing here is going to be, it's okay, this whole word here is a name of a condition. Now, exophthalmia is okay, that is pretty much okay as well. The patient have, okay, as it looks like as his or her eyes are going to just, okay, fall out of the socket or orbit. Now,
Is that
yeah.
like a bulging eye?
Well, okay, let me just give you go, guys, the page number where you can find a picture of it. It should be in chapter 4 if I'm not mistaken. Where are you? Your fingers, your fingers. Oh, yes. Oh, maybe it should be quickly. Yeah, you can put it that way. It would be, yes, okay. You can put it as a bulging eye. But there should be a picture. Okay, let me see. So, I should have, that's a very characteristic example of exophthalmia. Oh, let me see. Maybe I find it in ethics.
I think I found a picture in this chapter.
Okay, it is in this chapter.
Is it this?
No, I don't think so because it says on another page. Let me see. Oh my God. No, okay. Okay, once I find it, I'll tell you guys what it.
Is
But
it
pretty
this?
much a one. Yeah, this one. Yeah, exactly. Which page are you on, my dear?
17.
17th. Okay. Oh yeah, here we go. Yeah. Figure 1.10 on page 17. That's a typical example of exophthalmos. So what does that look like? As yes, okay, this lady's eyes are about to fall out, right? Okay. And most likely as okay, who would she like to see? Well, okay, this
Optometrist?
no, because optometrist mainly is okay, primary is okay. No, that's when you actually as okay have to look at the word opt, which practically is okay, although as okay we refer to it as eye, so actually as okay means sight.
So that is an ophthalmologist?
That would be an ophthalmologist, which is this fellow. Because the word opt actually is okay. Actually is okay means sight. That's why you may see as okay. Optics. We need to fix the optics or the view. That's why it's okay. You is okay. The guy who prescribes you your glasses is an optometrist. Okay, now they don't necessarily have to be medical doctors. But yes, okay, for eye conditions, that's okay. You will see an ophthalmologist. Which means okay, just going to okay have been done the logi of the eye. Which is going to be okay, ophthalmology. Right. But the word opt is okay will be used as okay referring to the eye, but what the word opt actually means is sight. Or you can say it's okay viewing. Is that clear?
Yes.
Now, guys, the reason that we can be is okay, just and okay, as I say, it's okay, the word opt. Now, practically is okay, or actually is okay, just means sight or view. Why is okay, we also use the word opt to refer to the I. Now, probably that's okay, it's a term that is not written in your book. At least not here. And that is ought. Okay. It's not written in your book, and that is ought. And some of you will say, okay, then what in the hell is ought? Because, okay, guys, the main thing that I want to say is just a matter of, okay, it's one letter. Now, the word ought means ear. So we say, yes, okay, optic was pertaining to the eye. You say otic or autic is pertaining to the ear. But yes, okay, if you don't look close enough, yes, okay, you may miss the vital information. Now, since we have the ear in the discussion, or the ought, we can say that's okay, ought. Oh, that's okay. That's okay. Ought. It is. Now, generally, it's okay. What you just recall is okay, an ear infection. Right. Although it's okay, the correct word for it's okay, otitis. Oh, because it's not correct, but it's okay. The most common form of ear infection is what we call otitis media. Yeah, guys, this media here is not social media, not Facebook, Twitter, Instagram, TikTok, YouTube, or something like that. But the word media here actually is okay, means middle. So it's okay. Common type of otitis is otitis media, which means it's okay, it's going to be what we can say is going to be the infection of the what is referred to as the middle ear. And that's pretty much okay. The middle ear, that's going to be what is deeper than your eardrum. So the eardrum is actually is okay, a separator between the outer ear and middle ear. And then we have something which is going to be the inner ear. Okay. We then just for having as okay, if that gets infected, that's going to be as okay, what you call otitis interna. Did you guys get that?
Yes.
Yep.
Yes.
So I think okay, the word odd is being brought up in the books at some other point. But the reason that I wanted to bring it up here is that it's like, hey guys, just one single letter on or off, yes, okay, will make yes, okay, a hell of a difference. Okay. Any questions?
No.
Nope.
Okay, so you can make yes, okay, just write art in your book here now, it's okay, and say yes, okay, just add it as ear. Okay, guys. Now the next is Osti. Sight. Very many is okay, it just says okay, Osti was bone. The O here is yes, okay, just our combining vowel. And the word sight, yes, okay, we should already know what that means. Is cell. So osteocyte is nothing but is okay, just what we can call it, okay, a bone cell. Here. We talk more about yes, okay, osteocytes when we go to the or when we okay talk the skeletal system. Now the other day when we talked arthritis, I did what we said. Oste, O, and then we says okay, said Arthur, and then yes, okay, our favorite, it is. Where okay, oste still is bone. O here means yes, okay, just this yes, okay, our combining vowel. Now the word Arthur here is okay, practically yes, okay, meant joint. And itis is an inflammation. So practically, it's okay, what osteoarthritis actually was, it was a form of arthritis. But then it's okay, the details that, okay, what happens in osteoarthritis is mainly it's okay that if you say it's okay that we had a joint, where we have two bones. Okay, now what mean is going to just, okay, cause this inflammation here. Mean is okay because what the bones have is okay as something that we call cartilage, and that's going to be this cartilage here that gets damaged or destroyed due to inflammation. And what we end up having is osteoarthritis, which means okay is inflammation in the joint space that causes destruction of the cartilage and end up leaving us with two raw ends of bones that will be rubbing up against one another. And that is ouch. Okay, that's not a pleasant feeling. Okay. Now, guys, the next two words that I am bringing up, please pay attention. Because, okay, what I mean is, okay, I'm going to do with that is I'm going to, okay, introduce not only as, okay, 2 new suffixes, but actually as, okay, use those to, as, okay, describe what the difference between them are. But we're going to say, okay, we're still going to, yes, okay, use the word Osti. And let's just say, yes, okay, Osti. And of course, that's okay. Here we have O and O as our combining vowels. Clear? Yeah, I hope that we now know that, okay, it's Osti in both cases, okay, will mean bone. The O's are our combining vowels. Or in science, okay, we can even, yes, okay, for this instance, yes, okay, say, well, okay, we may not use this O here as a combining vowel. But just also, I guess it's a part of our suffix, which is oma. So what do we have here? Yes, okay, osti, oma. Where we know that oma, yes, okay, either meant mass Yes, guys. Can you guys hear me?
Yeah.
Yeah.
Okay.
Yeah.
Okay. I was like, okay, did I lose you guys? So the bone. Right. Okay. So when we say it's okay, osteoma is going to be it's okay, a tumor of the bone. Clear?
Yes.
Now we go to the next one. And what we mainly will say is that's okay, it's going to be oste, which is bone. O here is going to be it's okay, our combining vowel. And then we go as okay, sarc. And then we go, we can say it's okay, oma. Yeah, my dear guys, the word oma here is okay, again will mean that okay, yes, this whole word here, osteosarcoma. It's okay, it's going to be a tumor. A tumor of the bone. Okay. Now, guys, comes, because okay, if you look at it, yes, okay, osteoma. And if you just took the sarc out of, okay, as this word here, it will also have become, yes, okay, osteoma, right? That both of them are tumors of the bone. Now, when we say as, okay, osteosarcoma. Now, practically, as we will see in a little bit, it actually is, okay, we refer as, okay, a call as, okay, the word sarc. Actually, is okay, they say it's okay, it means flesh. Okay. Now, word flesh or sarc practically, yes, okay, is what would mean, yes, okay, myo or muscles. Because guys, when you guys eat flesh, is there anybody who is vegetarian? Please raise their hands. Nobody is vegetarian. So when you eat flesh, what is that you're eating?
Skin.
Ah, not really.
Muscle.
You eating the meat, and what is it that the meat is?
Muscle and fat.
Muscles.
Right.
The fat will be fat. Okay, you can still take off the fat, and yes, okay, what are you left with? Muscles. Okay, so that's where it's okay the word flesh come from. Okay, okay, but, or practically, okay, but when we use a word sarc, especially that's okay for sarcoma. Sarcoma. Okay, now the oma is going to be as okay tumor, but not only of flesh or of muscles, but involving what we will call as okay connective tissue. Okay, okay, guys. Now, what the connective tissue is, we will talk about that in detail, not in detail. Just briefly touch that in your chapter number 2, or the upcoming chapter. And then, yes, okay, further details in A and P. Okay, but guys, for now, just remember this much. Your bones, now mainly because, yes, okay, your bone is an example of a connective tissue. And when we use the word sarc together with the oma, this sarc here actually is okay, makes this tumor here become a malignant tumor. Or a malignant tumor actually is going to be as okay what we will call cancer. So a malignant tumor or a malignant tumor of the bone is going to be called an osteosarcoma. Whereas an osteoma is mainly as okay, still going to be a tumor, but we can say it's okay, this is going to be a non-cancerous tumor of the bone. A non-cancerous tumor can also be just simply referred to as benign. Benign tumor is
So
non-cancerous.
osteoma is non-cancerous and osteosarcoma is cancerous?
Yes,
Okay.
clear? Okay, so whenever you see as okay, you can say as okay the word sarc along with oma, and it's okay when it is going to just okay be used together with a connective tissue that automatically as okay becomes malignant or cancerous. Okay, so both osteoma and osteosarcoma were or are tumors of the bone. But when we say osteoma, it is going to be as okay a non-malignant tumor of the bone, or what also can be referred to as being benign. Where you say as okay osteosarcoma But okay, yes. Oma becomes just okay, tumors, osteo of bone, but the sarc means that's okay, makes it a malignant tumor. Mainly because your bone is a connective tissue. So when you see the word that's okay, sarc together with oma, when you're talking about okay, connective tissue, that sarc is going to make it malignant.
So is carcinoma the same as sarcoma?
Hamida,
Is carcinoma the same as sarcoma?
the only, we can put it this way, my dear. The thing that is similar between carcinoma and sarcoma is that they are both malignant cancers. Because what was it that we said that carcinoma was?
Cancerous? Well,
Cancer,
carcin, right?
carcin.
Okay.
Okay. But when we say cancerous, referring to connective tissues and muscles, those cancerous tumors of connective tissues and muscles are not going to be called so-and-so carcinoma. It's going to be called sarcoma.
Okay.
Clear?
Mm-hmm.
Did you guys get that? Okay. Now, since we are at it, maybe it's okay, we can just take, okay, as another example. Let's just take our example of regular muscle. Because, okay, what is it if you have, just okay, we can have my, and okay, yes, we can have my. Now here we will see as okay. It's okay, this my here is okay. In both cases, okay, just comes from myo, which means muscle. Right? There, okay, yes, then let's go and say oma. The oma here is okay, we just yes, okay, maybe it a tumor of muscle. Right? They mainly as okay, just you can say that's okay, intentionally that's okay, remove this O here, otherwise it will become my uma. Okay, which would have been okay as crazy. So simply as okay, my just derived from myo, which is muscle. Where we just say okay, muscle is mainly as okay, nothing but flesh. Which practically as okay will as okay be represented as okay now with the word sarc. Because that's when we say as okay, sarc, and then we put the word oma. Now the word oma here as okay just makes it as okay a tumor of. That's okay, your my, which is muscle. But what the sarc does, meaning because okay, it that it mean is okay, cause this tumor here is okay to be as okay, verticus is okay, cancerous tumor. Okay.
Is it myosarcoma sarcoma or is it just mysarcoma?
No, also my sorry. That can say you may up for my yes, okay, come back.
Thank you.
Okay, thank you, Jeff. Right, okay. Okay. But the reason that we don't use the word carcinoma, it's not called myocarcinoma. because here the tissue in which is okay the cancer, the tissue in which the cancer developed. In this case, it is okay was the plain muscle, which is going to be referred to as okay with flesh. Okay, so sarcoma, sarcoma, sarcoma. Roughly speaking, guys, is mainly as okay, just going to be as okay, we can say together. Malignant now, which we also as okay can call cancerous. Tumor of. Now the tissue that we're talking about here is going to be as okay either muscles. The muscles is going to be as okay myo or my. And yes, okay, even if you, for instance, okay, even if we chalk off or we refer to as okay as connective tissues. What are connective tissues? Well, okay, we'll talk more about that in chapter 2. But we already said, okay, one example of a connective tissue is bone. So the same word referred to as okay that we see as okay osteoma does become as okay tumor of the bone. But okay, here is okay because it's plain oma. It is going to be as okay non-cancerous. So you're not going to hear the word osteocarcinoma. It's either osteoma, which is non-cancerous, or osteosarcoma, which become cancerous. Like, okay, you can say, okay, the word carcinoma is mainly as okay if we talk about things such as epithelium.
You froze again.
Am I unfrozen now?
Yeah, you're back.
Okay, I know. And now it tells me that my internet connection is unstable. Okay. So carcinoma, guys, is mainly going to as okay be if we talk of okay as cancers developing in ducts, epithelium, glands. If you guys remember, yeah, the first day we said adeno. Carcinoma was cancerous tumors of gland. And we even then back then said adenoma was non-cancerous tumors of glands. Okay, so for glands, we don't use the word sarcoma. For epithelium and skin and so on, so yes, okay, we don't use the word sarcoma to represent malignant tumors. Then in both instances, okay, oma was what you want to call it, okay, benign, whether it was things such as glands and so on, so, or yes, okay, even yes, okay, here for connective tissues or muscles, okay. But please, 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 please be aware that there are words which are not going to be carcinoma. Okay, you will not find the term carcinoma. You will not find the word sarcoma in them, but they will still be malignant. And a common example that I usually talk of is a hepatoma, tumor of the liver, which are not benign. A hepatoma is malignant. I think I specified that one very first day of the class. So although, yes, okay, you don't find the word carcinoma in it, although you don't find a certain, okay, sarcoma or anything like in it, it is still a cancerous tumor or mass of the liver.
Question.
Yes, my dear,
Would that be the only one?
you can put it that way for now, yes.
Okay.
There's another one that's going to be, okay, myeloma. Now, we'll talk about that one later on. It's a little tricky one because myel, M-Y-E-L, means two things. It's one word for two things.
So for now and like for this upcoming quiz, we don't have to worry about that one?
No.
Okay.
Guys, I told you guys that day number one, I will only ask you about things that we have talked about. Okay. Now, God forbid. God forbid that, okay, as a question or so may have slide it into the chest that, okay, as I didn't mention. Not the question, but as, okay, the thing that's been asked in it. Then that's on me. That's okay. If you still manage to, yes, okay, get the wrong answer, you get the credit. If you didn't get the right answer because, well, okay, you had no idea because we never talked about it, then that's going to be on me. You'll be getting the credit. Okay? But I make sure that, okay, as whatever I intend to, yes, okay, throw as question towards you, as okay, has been discussed in less or greater detail, yes, okay, in the class. So is there anybody who is in doubt? So yes, okay, when we go to chapter 2 at some point, yes, okay, and say, okay, these were the connective tissues. These were their names in English. These are their, okay, yes, medical terms. And then we just put, yes, okay, omas, that would be the benign tumors. Sarcomas will be the malignant tumors. And some of you say, why do we call them benign and malignant? Well, okay, that's a whole different discussion. We'll talk about that in chapter 4. But mainly as, okay, malignant is going to be cancerous. Benign is non-cancerous. Okay, I think I froze again. Okay, okay. But then are not tumors, but just masses. Like hematoma, right? Your black eye, your bruise. Now let's check this one here, and that's okay. That's a funny one. I just briefly mentioned it just a little while ago, and that is path. And of course, that's okay. We may have okay as if required, that's okay. Combining vowel, which is O as in orange. Well, what does the path mean? Now I told you guys that okay, path doesn't mean it's okay a road that you take.
A disease.
It mainly means disease, or it's a fancy word for disease. Now, some of you may have heard the subject or heard the word path or logi. Pathology says, okay, now this is going to be, it's okay, we can say, let's call it, okay, the study of. Now, when we say pathology, yes, okay, not just okay as disease. But actually, that's okay, what they study in pathology is going to be, it's okay, we can say it's okay, diseases, development. Right, okay. The other day, guys, can you guys hear me?
Yeah, you're back.
Okay, I'm back. I don't know what the,
Now we can.
okay.
And you're gone again.
Yeah, you froze again.
Let me just ask my wife to reset the thing is okay during lunch break. So until that is okay, just try to bear with me. Okay. But the other day we talked about, yes, okay, for instance, tobacco. I'm frozen.
No, you're back now.
Back.
I'm back now. Okay, but some of you look frozen. Okay. Now, so what is it that pathology do? Pathology mainly is okay, is all that discussion. How is it? And what are the changes that causes that okay as tobacco smoke leads to cancer? So how does tobacco smoke end up make changes in the lungs, for instance, that is okay may lead to yes, okay, lung cancer? Did that make sense? So that's okay. How is it that disease develops? And we can say that what are the physical, what are the functional changes that happens in an organ during those changes, as okay that disease develops? That is pretty much okay. As roughly speaking, is okay what pathology is going to be about. Okay, and a pathologist means as okay just a dude or a chick who has okay have studied that. Usually, guys, you are not going to have physical interaction with the pathologist. When you go to see your doctor, you probably never going to see the pathologist who has okay looks at your specimens and so on so, because they mainly as okay sit in a lab, either as okay behind a microscope or whatsoever. Or in a lab, it's okay where they conduct different yes okay chemical tests on the specimens that you have received. Is that clear? Okay. But it's okay, after it's okay, processing, it's okay, he or she will come and say, okay, we saw these and these and these and these changes in the specimen, these and these findings, so on, so on. So based on that, this is what we think it's okay that this specimen here contained. Okay. Any questions? So the main is okay, just deal with biopsies and autopsies. And I hope I talked about it, okay, what biopsies are and what autopsies are the other day. Okay. No, we can just okay. Whoopsie. Now we can say it's okay, pathic. Well, okay, that just becomes pertaining to that disease. Right, okay. Now, guys, I'm still going to write the word at. I'm still going to write the word ick, which just becomes just okay, pertaining to disease. But we are going to just okay, put a prefix in front of pat. And that is going to be idio. Now, does anybody know what idio means? That's fine. You have no clue, and you're going to just okay laugh once I talk or once I tell you that. Get out. Idiomale is okay, or me is okay, not. No. So when we say it's okay, idiopathic, okay, we actually is okay, don't know. That's okay, we can actually say okay, pathology. We don't know it's okay how the disease developed. But if you just look at the word idio, and I'll just go into this, okay, my big fat Greek wedding mode. And then just look at this word here. What's an idiot?
Somebody who doesn't know anything.
Okay, and okay, yes, what do you feel like? What do you think yourself of? You say, how couldn't I think about that? What an is it that I am? I told you guys that's okay. If logic comes from logic, likewise, okay, yes, I didn't say it that time, but that's okay. Idiot comes from the word idio, which you say is okay, well, okay, we don't know. Right, okay. So that's okay. A lot of conditions, a lot of diseases which we now may think that we know, yes, okay, how they developed, what may trigger it, and so on, so on, so on, so on. So back in the days, what's has been put into is okay, a big box as idiopathic. Okay, we see something has just happened. Okay, something is okay, shows up, so and so. Okay, we see some sort of okay as disease or symptoms and so on. But what caused it, what triggered it, how does it develop to this stage? We have no idea. So those things, I mean, is okay, just put into one big box that we say, well, okay, idiopathic. We don't know as okay what goes on. Did that make sense? And then they as okay start to as okay camouflage it with the word that okay Caitlin used the autoimmune. Okay, we don't know what is happening, but okay, we won't call ourselves idiots anymore. So that's when we go and say, well, it's probably your body's immune system that is reacting, which we just okay call as okay autoimmune. But then the question goes like about what the makes our immune system go bananas like that. We still don't know. So no matter how you circle it around, it's okay, you come back and say, well, okay, I had to confess, I'm still an idiot. Okay. Okay. We may know a lot, but it's okay. Uh, Nobody will be able to know everything. Clear? Okay. So if I ask you about yes, okay, the history of something, you may say, I have no having idea about that. Did that make you an idiot? No. You just don't have yes, okay, you just don't know about that specific minute thing that I asked you. Okay. So that's why I told you guys that's okay. And that happens because okay, I just look at things like that. Because okay, I had to it's okay to learn a bunch of languages at this. So that's okay. Anyways, so now you know where the word idiot come from. Okay, it come from idio, which means okay, we don't know. Okay, but if you keep on saying yes, okay, I don't know, I don't know, I don't know, it doesn't really matter what you're being asked about then. At some point, it's okay, the person who asks you may say, sorry, what an IDIOTRU. But okay. That's fine. Dr. Tracy, the little furry fairy, yes, okay, he may join the class as well.
He's being bad.
Okay. Yeah, you should let them, you should watch some Caesar Milan. How to keep, yes, okay, those fellows off the couch. That's okay, dear. Now, guys, psych. And we can say it's okay, it may as okay be followed by a word or it's okay combining vowel O. Now, guys, what the word here means is, or what the word psych actually means is mind. Now, some of you will say, well, okay, isn't mind and brain the same thing? Isn't mind and brain the same thing?
No,
Well,
No.
yes, did somebody say something?
Oh,
It-
I just said no, it's not the same.
It's not the same thing. Good. Because you can mainly says, okay, well, okay, the relation that they have is that, okay, as mind is to brain, as spirit is to body. Okay, maybe that was too much preaching. Okay, so I don't hope that you guys will come across a person with psych. And here's okay, this O is not a combining vowel, but actually it's okay, is the suffix, which will be this, which is going to be as okay and abnormal. Okay, so what psychosis or what we can call as okay, if you say psychosis, that's okay, we can go and go, say that's okay. A person with psychosis is psychotic. That actually means that he or she, usually it is a he, is crazy or nuts. Have any of you ever seen a patient with psychosis? No? Now you may find them, okay. Ideally, it's okay, they shouldn't be standing at those corners talking to the light pole or something like that, but it's okay, that may be what they're doing. Or you may think that they are talking to the light pole because you see them standing by the light pole talking to you, it's okay, facing the light pole. Or what they think is that that light pole is okay as somebody. Okay. They need help. Okay, you may see them as okay in the subways, not the sandwich store. Okay, okay, the subways in New York. As okay, if they get out of the train, it's okay. They're walking down. It's okay. Uptown, midtown, downtown. Okay, so that's okay. Not funny people to deal with because you don't know when they're going to go from as okay verbally nuts to get physically nuts or crazy. Okay, so that's okay. Psychosis is that's okay. Here it's going to be that's okay an abnormal state of mind. But where it's okay, the thoughts on it, it's me. It's okay. Just it's too much. The opposite of that is going to be depression. Yes. It's the opposite of psychosis. A person with psychosis is going to be as okay at the top of his lungs. Usually people with depression, okay, just go and sit in a corner. Sniff, cry. So it's more or less okay inside. And we can just say it's okay, since we had it, you can say it's okay, psych. Or it's okay, we just talked about it and it's okay just a couple of minutes ago. We say it's okay, psych. Here we will have okay as a combining vowel, which is the O. And then we have that's okay, the verb pattern. So yes, okay, that's just okay as the extreme way of a psychotic patient. But then somebody will say that, Mike, there's also this okay a movie that is called Psycho. Have anybody ever seen that one?
Yes.
Okay. So are you into horror movies, or that just happens to be one of the few ones that you've seen?
Just saw it somewhere along the way. Yeah.
Ah, okay. I heard a lot of it. I seen that clip with okay the character, but I never watched the whole movie. So, okay, guys. Now before that's okay. Okay, yeah. Good. So just take your lunch break on time today. And when we come back, it's okay. We will talk a bit about it's okay, some of the remaining. Or should I say that I see you guys back at 12:40? 40? Is that fair enough? Okay, guys. Have fun tonight. Hey, guys.
Hi.
Hi there. Welcome back. Okay, okay. Any question, guys?
No,
Good. Now let's just go to Rhine. With a combining vowel O, which is rhino, or which makes it rhino. And this word here means nose. Now we can say is okay. The first one we're going to talk about is Rhine. It is. Okay, which is just going to be as okay. Most likely it's okay, either inflammation in rare cases. Infection of the nose. Okay, what usually may happen in rhinitis is going to be as okay, what we'll call Rhine. Oh, Rhea. Now I hope you guys know that's okay, that this is still that's okay, your nose. This is just the combining vowel. And now what the word Rhea actually that's okay means is discharge. Okay. So the word RHEA, RRHEA, means discharge. But in this case, that's okay. It will actually, it's okay. Or what it mainly would mean is running. So rhinorrhea is going to be a nose that is running. Now, just as okay. Runny nose. Okay. So rhinorrhea, yes, okay, runny nose. Mainly because of, okay, we can say it's okay, discharge, that's okay, from the nose. Because the word rhea actually means discharge. Now the last word that we may talk often, looking context to rhino, is going to be rhine. And then we go O. Where the word rhine still means that's okay, nose. O means, or is the combining vowel. And here we go. Plasty.
That's nose surgery.
Yeah. But what does the word plasty mean? Now here we can mean it as okay, the Y mean is okay, just makes this whole word here becomes just okay, because it's either a process or in this instance it's okay, procedure, right? Of plast. And practically it's okay, what is that this plast here will mean?
Surgery?
No.
Oh.
Repair. Now guys, if you look at this word here, you may then see it's okay, it's because from plastic comes plast. Ick. The ick here is just going to be pertaining to plastic. So guys, usually it's okay if you say, for instance, something like as plastic surgery. Plastic surgery. Well, surgery is mainly as okay because it's okay to do surgical procedures. But it's not called plastic surgery because of okay, as different plastic implants and so on. So, but this plastic here is okay, comes from the word plastic. It's pertaining to plastic. Where plastic mainly means repair. Did that make sense?
Yeah.
Okay. And okay, guys, this is a term that what's his name? Michael Jackson would know a whole lot about. Have you guys seen the program Botched?
Yeah.
Yeah. One of those dudes in that programming is okay, just focuses on rhinoplasty. So that you can say, okay, his specialty. But just look at a timeline of Michael Jackson, what happened to him over the years. So, well, okay, good was good, but then too much good goes bad. Okay, he could probably have left that thing alone. Okay, everybody has their own way of looking at this. So, guys, that's okay, plastic surgery. And that's probably okay where things have gone wrong is the primary goal of plastic surgery has completely gone off track. And that's why you see is okay, things that ends up in botched. Because what the primary goal was mainly is okay to fix, if you want to put it that way. Things which were either as okay, you can say it's okay, birth defects. Common birth defect that okay, as most plastic surgeons would be dealing with was what we call cliff lip and cliff palate. Okay. Next thing would be as okay, things such as okay as dealing with okay as people who had suffered severe burns. That's scar tissue and things like that. And okay, as fix it in a way that okay, as the patient still will be able to is okay, you can just okay use his limbs, arms and legs. Even if you talk of okay as things such as okay as fixing the nose. It should only be touched if you are having problems in breathing. And then okay, yes, implants such as breast implants. Or the primary reason why somebody has okay said, okay, this could be a cool thing to do or invent. For people who suffered the loss of a breast because it had to be removed due to one reason or another. That was the whole thing. But yes, okay. Where are we now? Yes, okay. In a whole different track, or we actually have gone off track. Right. So first as okay, it was immediately came from correctional or reconstructive, if you want to put it that way. That would mean it's okay or plastic surgery. Now it has gone from it's okay, plastic surgery or correctional to cosmetic. So yes, okay. But guys, again, yes, okay, the nose, well, okay, yes, it may be known by Rhine. Another word that also is okay means the same as nose is nas. You can say, okay, in this case, you can say, okay, nasal. That's okay, yes. Pertaining to the nose. If we say Rhine, it's going to be rhinic. Okay, so both of these mean the same. It's okay, pertaining to the nose, pertaining to the nose. So it's okay, the nose can go under two words, either it's okay, Rhine or nas.
So nasal and rhinic are both pertaining to the
pertaining
nose.
to nose, exactly.
Okay.
But it's okay when we say nase, it's going to, it's okay, it's going to be L. That will be a suffix that means pertaining to. When you say Rhine is going to be ick, that will be the suffix that means pertaining to. Right, okay. Now, guys, we are, yes, okay, chalk, sark. Right, okay, or sark with the combining vowel O. Which we mean is okay, just says okay, the sark mean is okay, will be flesh. Clear? Okay. Now what you will, not really in much detail, but it's okay when we go to, it's okay, the muscular system. We may see it's okay, something that is going to be called, it's okay, the sarco. Mirror. And sarcomere is mainly, it's okay, just, well, okay, to be, it's okay, the basic contractile unit of the muscle. Okay. So yes, okay, your muscles is going to be made up of multiple fascicles, where fascicles are made of multiple muscle filaments, where muscle filaments are made up of multiple sarcomeres, where sarcomeres are made up of two contractile proteins, actin and myosin. So you have to have actin and myosin together to make up what we call become a sarcomere. Where okay, yes, the word sarcomere is okay, comes from flesh. As I said earlier, it's okay. You have a piece of steak, or okay, yes, you eat flesh, and that flesh is mainly as okay, just the muscles. But, although yes, okay, the word sarc means flesh, which is muscles, but the word sarc can also, yes, okay, be used for what we call as okay, the connective tissues. And if you said, for instance, that's okay, sarc, sorry, sarcoma. If you said sarcoma, that is just going to be as okay, malignant tumor of either or become muscle or, sorry, your connective tissue. Okay. Where, okay, for muscle, we will just, okay, use the word for muscle, which is myo. Where, okay, as for your connective tissue, we will use the word representing for the specific type of connective tissue. And then says, okay, that tissue sarcoma, that tissue sarcoma, that tissue sarcoma, that tissue sarcoma makes it a malignant or cancerous tumor of that tissue, that tissue, that tissue, that tissue. Did you guys get that?
Yes.
Where we said tissue and just oma, no sarc, no carcinoma or carcin. In most instances, okay, there will be non-cancerous, except from liver and skin. Okay. Okay, now yesterday somebody asked me about clotting. And that's what we will talk about next, which is Trump. THROMB. Trump. Which means clot. Now, if needed, yes, okay. This may be accompanied with a combining vowel, which is our favorite O. Now, we can just take an example and say, yes, okay, if we say Trump O site. Okay. Now, thrombocyte, yeah, okay, that means it's okay, going to be a cell. Not really forming the clot, but because it's okay, actually going to yes, okay, be responsible for the formation of clot, a blood clot. Okay. Now this thrombocyte here, yes, okay, is one name. These may also, yes, okay, be known as platelets. Okay, so a thrombocyte may also be known as a platelet. Okay. And we will talk about, yes, okay, how these platelets, also known as thrombocytes, ends up, yes, okay, causing the clotting of blood. Is that clear?
Yes.
Okay. But the reason that they call them thrombocytes is because, okay, these are going to be the cells that will, well, you can say, okay, trigger the formation of a clot. Now we can just go to the next word, and that's going to be as okay, what we will call as okay, thromb. Now, in some cases, okay, this may just be as okay, the combining vowel. And in some cases, okay, it may not be. But here we can just say as okay, if it is considered as a combining vowel, then this is just going to be as okay, that this whole word here becomes the procedure of clotting. So generally, as okay, what we can say is okay, the procedure of clotting of blood is called thrombosis. But there also are going to, yes, okay, be examples where, okay, as this word here, thrombosis actually is okay or mean. You can see, right, osis, which what we mean is, okay, said abnormal condition or procedure of clotting. And of course, that's okay, of the blood. Okay. An example where it's okay where this, or that's okay where you actually may use the word thrombosis as abnormal clotting can be as okay what you may come across, which will be as okay what we call deep vein thrombosis. Here's okay, this is going to be as okay abnormal clotting of the blood. But they may say it's okay that it develops in what we can call as okay the deep veins. So we had thrombocytes, which was the cells of what we call platelets that actually is okay, leads to the formation of a clot by the procedure called thrombosis. That was normal because it's okay due to stop, it's okay because you needed the blood to clot because you needed a bleeding to stop. Or whether that is your thrombosis, that's okay, going out of control. And your blood just okay, just ends up forming blood clots. Which is going to be abnormal. Now, one example is okay, as a deep vein thrombosis. But that means, okay, just leads me to this, okay, the last point here. Or thrombus. Thromb. Because we can say it's okay. The word thrombus is what we'll call a blood clot. Clear? So we can mean says, okay, the thrombocytes as a result of thrombosis forms a thrombus. Now, guys, when you talk about it, okay, thrombosis, and you say it's okay, thrombus. Where we mean it's okay, now thrombus is, that's what we call it's okay, a regular blood clot. But then you may, as okay, along with this, come across another term which is going to be as okay, an embolus. And guys, what both of these two fellows here have in common is that okay, yes, they are blood clots. Unless and until it's okay, the word embolus isn't specified in relation to something else. But then you'll go and say, okay, but why do we now have two words? Why couldn't we just suffice with one word? So there's got to be okay, some difference between a thrombus and an embolus. Now, does anybody have any wild guess what that difference could be? Right now, any wild guess is welcome.
Yeah, I was gonna say I definitely don't know if this is right, but like where it's occurring in the body.
Okay, so you think that it's because it depends upon where it occurs in the body?
Yeah,
Okay,
I guess.
it's okay to guess. Nobody gets killed for guessing. That's why I say it's okay. Any wild guess. Okay, Clint, that was not the reason. But it's okay. Damn it.
Does one of them move?
Exactly. Now it's not going to be the one that says bus that moves. Okay. It's actually it's okay going to be the other one. So when we say thrombus, do you guys mind if I go to another slide?
No, that's fine.
Okay. So guys, if we say thrombus, now well, okay, yes, we had a blood vessel, and in that blood vessel, yes, okay, we had a blood clot. This blood clot here was going to be called a thrombus. Here. Now, what mainly yes, okay, will happen, well, okay, just because we have a blood clot doesn't, unless, okay, this blood clot completely blocks the blood vessel. Then we are having, us again, a whole different issue. But it's okay, blood may be flowing. And what may happen is that, okay, yes, that flowing blood may, yes, okay, rip off a piece or pieces of this clot. And these pieces of clots now are going to, yes, okay, run along with the blood flow. So this is going to be what you call an embolus. Now, guys, what we can say is, okay, at least, yes, okay, we know where the thrombus is. Once we locate it, we say, well, okay, he or she is located in this blood vessel in that part, or so on, so on, so. These fellows here, the embolus, we don't know where they're going to end up at. Right? They can go anywhere. They can go to the blood vessels in the brain. They can go to the blood vessels in the lung. They can go to the blood vessels in your heart. They can go to the blood vessels in your eye. You name it. Any structure which, okay, yes, needs blood, these blood clots or these emboli can go and actually, yes, okay. They mainly, yes, okay, well, let's travel until, yes, okay, the passage or the blood vessel becomes too small for it to be able to pass through. And it gets stuck. And if it gets stuck there, yes, okay, what is it it's going to do? Block the blood supply. So yes, okay, you have a thrombus, okay, good. Let's just hope that it doesn't produce emboli. Because if it does so, those can travel to any crazy place in the organ in the body and okay, has caused problems there. Go to the brain, you may suffer a stroke. Heart, you suffer a heart attack. The lung, you yes, okay, not you, sorry, that person, sorry, will suffer from yes, okay, what they call yes, okay, a pulmonary embolism. So you hear somebody else, okay, have pulmonary embolism, that's pretty cause, yes, okay, most likely it's okay that embolus travel and okay has blocked a bigger or smaller blood vessel to the lung. And not that the other ones are less a medical emergency than a pulmonary embolism, but just think, okay, as you can't breathe. And so,
So does an embolus always start out as a thrombus?
exactly.
Okay.
Right, okay. Now, and that's why I said, well, okay, until and unless specified otherwise, an embolus is going to be as okay, you can say it's okay, mobile piece of blood clot that comes from a thrombus. Now, guys, you may have if not, well, okay, at some point, it's okay, you may come across a term. And then you're going to come back to me and say, Mike, you have been misleading us because you told us that an embolus was a piece of blood clot. Well, okay, and that's why I said that is an exception. There's something that is called an air embolus. Have any of you ever heard of that one? No. Okay, let me ask you guys a question. Have you ever wondered that, okay, yes, whenever, yes, okay, you are getting a injection into your bloodstream, why is it that the nurse or doctor holds up the needle and syringe like that and tap it
To get
Get all
and
the
then
air out.
push on the post to get the air off? Why? Because if they inject that air right into your bloodstream, what are you having now? A little bubble of air is okay circulating in the blood. And you can't say, well, okay, more oxygen, better for me. No, guys, that's not how it works, okay? So that air bubble is okay circulating in the airstream, or sorry, in the bloodstream, is what you would call an air embolus. And okay, well, it's circulate until it's okay. It may come across a blood vessel where okay, the road is too narrow for it to pass, and it's just going to get stuck. Unfortunately, they can't apply a reverse cancer. Okay, let me just back out of the street because it's too small for me. That's not how it works. So that's why it's okay. You is okay for an IV, it's okay to run, and okay, just and you will see it's okay, a little bit of okay medication is okay. Taken out of the tubing, but that's mean it's okay, just gets us okay, wash all the air bubbles out. Because then who killed the patient? The person who didn't take out the bubbles. Okay, so yes, okay, there is something that we call yes, okay, air embolism. Okay, it's not going to be as okay a piece of cloth, but actually it's okay a small or bigger bubble of air circulating in the blood. Did that make any sense at all?
Yes.
Yes.
So now you know why. You may say, why did the nurse or doctor just waste a drop of medicine or whatsoever? Because they don't want you to okay inject that air into your blood. Okay, guys. Any questions? Okay. And okay, as they may put yes, okay, these two words together, thrombus and yes, okay, embolus. And you may see yes, okay, that has going to be something that they call, sorry, Trump. And here it is just going to use O as a combining vowel, but then the C is okay. Embolism. Okay. Which means is okay. Producing is okay. Emboli from thrombus. Now, just one last thing, guys. And well, like we're just going to go and talk and use the word Trump. We're going to just okay use a combining vowel, which is O as in orange. And then we're going to say it's okay. Lie. And lastus cis. Now, what did the word Trump mean? Clot.
Clot.
We can say it's okay. What kind of clot? Well, okay, we can say it's okay, blood clot. O here was mean is okay, just our combining vowel. Now, what the word lie here is okay. I mentioned that yesterday, it's okay, it is derived from the word lice, which means it's okay, just means breakdown. But here it's okay, they just took it's okay this off and say it's okay. Cis means it's okay, just becomes the, because it's okay, process. Or in some cases, okay, procedure. Now, guys, this thrombolysis here is okay, it can happen in 2 ways. It may be normal once the blood clot has served its job. It is going to be broken down or dissolved. Mainly it's okay by chemical mediators in the body that's going to go and eat it up or break down that blood clot. Okay. Now it can also, as okay, be a procedure. Mainly in the terms because, okay, what they may do is, yes, okay, with the help of drugs. Okay. Give the patient now very, 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 very potent drugs that is going to just okay go and act upon as okay the clot, and actually as okay is going to break down that clot.
That's not like blood thinners, is it?
No,
Okay.
now blood thinner, that's probably something that you will be taking pretty much okay lifelong, unless and until otherwise directed otherwise. Clear? Okay. And blood thinners is more as okay on a long run. This here is okay as within a couple of hours. Within a couple of hours of, you can say as okay, suffering from something due to as okay the development of a new clot. Now, guys, the main department that I worked at, where we actually is okay, introduced this form here of treatment as an option, was in neurology. So people who, yes, okay, just suffer a stroke, and if you could bring them in get them started on this treatment here within 2 hours. Or you can say, okay, the occurrence of their symptoms. You're actually going to be able to, you can say, okay, be able to say, okay, dissolve this newly formed clot that would have caused them as okay suffering from a stroke. And in many instances, okay, they could walk home the very next day. Okay. But it's not going to work at okay as well. Okay, I had a stroke 5 years ago. It's okay as an old damage. There was a clot back then or something. No. So our time frame at that time was 2 hours with occurrence of symptoms. So if I yes, okay, I had a stroke now, 126, they could start the treatment at 326. Well, okay, that was it. If it took me longer time to yes, okay, get to the hospital, and they couldn't start at 326, okay, then so okay, time passed. It has to go the natural way. Okay. But that's okay. And that's why I says, okay, these are more potent than regular blood thinners. Now remember when that thing was introduced, it was pretty much okay, very fancy because okay, it was okay, mainly as okay, the only hospital in Denmark where we are offering this treatment. So we can say okay, the pioneer hospital to offer that treatment for stroke patients. Now, at that day, yes, okay, I was working at okay as an emergency. And they called me and say, Mike, you have to come and finish a report for a death morse. I say, well, who died? And they say, well, okay, there's this guy where we actually offered thrombolysis who passed. And I say, okay, well, I haven't heard of somebody being critical. Like, okay, where did he just drop down from the blue moon or what? Because even if he was brought in, he has to be brought in via me. Okay, I would then say, okay, call the relevant consultant and say, okay, well, okay, you take it from here. I did the preliminary things and so on, so on. So, because that treatment was only us, okay, it has to be a consultant who would, yes, okay, administer, yes, okay, you can say it's okay, those medications. And they said, well, you didn't see the patient. I said, okay, I didn't see the patient, but okay, what is it about him? Well, like he was brought in from Holland. It's going to be like, okay, saying it's okay. We brought in a patient from, it's okay. What's the what do we know? Like, okay, from, you can say it's okay, Peru or something like that. I said, okay. I guess we have some paper on him. Now, when I walked to the department, what did they give me? A big stack of papers. I said, okay, first of all, I didn't receive the patient. Okay. Usually, if somebody called me and said, okay, a patient is on the way, he or she will give me okay, a brief scenario of what the case is. Second of all, I didn't receive him. I didn't see him. I didn't administer the treatment. I don't know what went wrong since he now is gone. So why should I be sitting here as okay, try to as okay, make up a report? That should be the guy who just okay took care of it because he received a call. He said okay. He did the scans. He did this. He did that. He administered the drugs. And on top of that, just okay, I can't use these papers for anything because, guy, they were not written in English. They were not written in Danish. They were written in Dutch. And I say, I may know a lot of languages, but Dutch is not one of them. And yes, okay, guys, I'm talking pre-Google Translator time. Right, okay? But let's be honest, even if it was just, okay, even if we had Google Translator, I say there's no way on earth that I'd be sitting in and, okay, try to just, okay, type Dutch into Google Translator and, okay, let's get that report printed out. Okay, so, yeah. Wow, that was okay. So that's okay. It was, and we had, okay, as a very strict protocol of, okay, things that should be clear before it's okay the treatment could start. But anyways, that's okay, thrombolysis. So that's okay where they administer some, that's okay, very potent drugs to break down. But when you say lyse, that's just going to be as okay, break up. Okay, when you say lysis, the process of breakup. Okay, when you say lytic, Lytic, then the tick just becomes pertaining to what? Lysis or breakdown. Any questions? Bătita vă nasty, la? Faci fizere? Huh? Okay, sorry guys. Cats and okay, yes. Okay, guys, so that was okay, some of the root words. Okay, just some. Now, should we just start with some of our suffixes? Okay. Okay, guys. Now, first of all, yes, okay, guys, let us just get straight. What was a suffix? And we mainly say that, okay, a suffix was mainly as okay going to be as okay what we can say as okay follows the root word. So if you have a root word here, whatever we write after the root word is going to be a suffix. Clear? Okay. But no matter, yes, okay, what root or whatever suffix we put, the new term that we get still is going to, yes, okay, mainly, yes, okay, related to the root word itself. We see that no matter what suffix we put for as okay different root words, even as okay the new words we got was still going to as okay be mainly as okay concentrated upon as okay what the root word itself meant. The suffix just okay as adds a different perspective to the word that we get related to our root word. Now, guys, the first one in the book is L. They go alphabetically. And what I say is, okay, L together with ik, together with R, together with il, and okay, as even as okay, in rare instances, okay, airy. They all mean pertaining to. Pertaining to what? Mainly as okay, the root word. Okay. Now we can just take as okay some examples of each of them. Now when we say all or L, example can be as okay neural pertaining to nerve, spinal pertaining to spine, cerebral pertaining to brain, renal pertaining to kidney. Okay. Nasal pertaining to nose. Dermal pertaining to skin. And so on. Did that make sense?
Yes.
We can just say it's okay, R. Vascular pertaining to vessels. Or we can say it's okay, blood vessels. We can say it's okay, muscular pertaining to muscles. Let me see. Okay. We can go ick. We can say rhinic. Nephric. Rhinic was pertaining to nose, nephric pertaining to kidney. Psychic pertaining to mind. Gastric pertaining to stomach, right? Okay. Where else? Otic pertaining to ear. Optic pertaining to eye. And so on. He also had, okay, yes. This is okay, EAC. And perform is going to be okay, cardiac. We can say eel. Esophageal. Pertaining to the esophagus. Now the esophagus, that means that's okay, what takes food from your throat to your stomach. We can even go and say it's okay, duodenal. Now this is just going to be as okay, a part of your small intestine. And okay, the duodenum is going to be followed by okay, as another part, which is going to be the jejunum. But we can say okay, it's like a jejunal. Okay. We can go and see it's okay, and that's why okay. Iliac. Or change to the ilium. There's going to be another thing which is going to be as okay, the peritoneal, pertaining to peritoneum. Now, a peritoneum is going to be, as means okay, going to be a sheet that pretty much okay as covers up most of your abdominal structures. I said most, not all of them. Okay, so pertaining to that is going to be as okay, peritoneal, sorry. Airy. Pulmonary is okay, pertaining to the lung. Let's see. So just okay as a couple of examples. Okay, so just okay, whatever all these fellows here mainly meant pertaining to. Pertaining to was just okay, whatever your root words were. Did I make myself clear on that one?
Yes.
Yes.
Good. Any question, ladies? Okay, sorry. Let's just take another one. Now we say L. Oh, actually, that's okay. We can do it this way. We can say alg. And then we can just say it's okay, E. The E main indicator, okay, whatever word we end up with, when we put algae after it, is going to be as okay, be the term for a condition. Where the word alg means pain. So we can say it's okay, algae as such means okay or mean. Sorry. Or we can say okay, it will be as okay, a painful condition. Painful condition is okay, pertaining or related to what? Well, okay, whatever the root word is. Now we can just put different root words and say, okay, where would that be painful condition of? We can say neuro, and we go, yes, okay, alg, yeah. Now, guy here is okay. This is going to be as okay, condition where the patient mainly has pain due to yes, okay, suffering of the nerves. Yesterday I talked about shingles, if you guys remember that. That's okay. What you may get as a result of that is going to be as okay, neuralgia. Mainly because okay, the shingles attacks the nerve and causes okay the nerve to start okay becoming painful. So that kind of pain is going to, yes, okay, or we call it, okay, neuralgia, or we can say it's okay, nerve pain. But EMA is okay, this indicated this is a condition. You may say it's okay, yeah, okay, yes, if it becomes it's okay, it becomes pertaining to neuralgia. Now, something that you guys may be having right now after listening to me. Let's see. Whoops, what the hell? Okay, get out. Sorry. Now, can anybody put this and this and this together and say, yes, okay, what does this thing here mean?
I have an idea.
You have an idea? Go ahead.
Mm, a headache.
Exactly. Right. Okay. Good guess. Correct. Headache. Now, Anjali, since you said it, is that what you're hearing after listening to me now?
No.
Okay. Just curious. Okay. Maybe I should then bring some Tylenol or ibuprofen into the class next time. Okay. Yeah. Okay. But as okay, what people may just refer to as a common headache is cephalgia. But I see you to say, I got a headache. Okay, it's okay. Using a term cephalgia, which is going to give the listener a headache. What the hell is this talking about? Okay. Now we can then say, it's okay. Maybe you don't have a headache, but maybe you have autalgia.
Earache,
Who was that?
Teresa.
Exactly, dear. Or you can say, it's okay, earache, or I mean, it's okay, just. You can say, it's okay, yeah. Painful condition involving, yes, okay, the ear. Now, guys, if I just put like this, what would that be?
Would it be pain in like your eye?
Exactly. Now, why would you have pain in the eye?
Maybe from like straining your eyes?
Straining the eyes, okay, good. Irritation, okay. If okay, there's a piece of firework, it's okay, blow up and okay, hopefully not, but was okay. That's what you would call as okay. Any painful condition involving the affecting the eye. Okay. Where okay, as it's actually as okay the word alg. That means pain. And E it just makes it just okay condition. Because if you go and say it's okay, algiac. Now then just becomes just okay, pertaining to pain. And that's why you may say it's okay. Now there's something that is called an analgesic. Now, guys, you should be very careful, yes, okay, how you break up the word because it may end up, yes, okay, meaning something completely different if you broke it up the wrong way. Maybe you can say it's okay, the ick. No matter what is going to just okay be pertaining to, right? Clear?
Yes.
Good. Now, guys, if you do like this, this for me is okay, it's telling me it's okay pertaining to the anus. And then you can only guess what guess means. Okay? So yes, okay, that is the wrong. That's the wrong breakup of this word. Because here is okay, your and. That is actually is okay, the prefix. You can say it's okay here. The word alg, sorry. It's okay, could be as okay, the root word. And then you can just say it's okay. Yes, don't worry about that, but that's okay. The ick is okay as pertaining to. Where okay, as the word al still means as okay, pain. Ick is going to be as okay, pertaining to. And where the word an means no. So pertaining to as okay, no pain. Or that is mainly as okay, or analgesic is mainly as okay, what we mean is okay, just may call as okay, painkillers. So the technical term for painkillers is analgesics. Did you girls get that? Oh, guys, sorry. Question. Right, okay.
Yeah.
So yes, okay, you have to think twice of how you break up the word because it may end up, okay, as having a completely different meaning if you break it up the wrong way. Right. Now, why did we use an as a prefix here? That means no. Because we may have a similar prefix that is going to be as okay. That means the same. Sorry. Which would be a. But the reason that we used an here is okay as the prefix is mainly because, okay, your root word, yes, okay, starts with a vowel. So just like, okay, yes, in English you say, yes, okay, you don't say, or you're not going to say a apple. That is grammatically wrong. You're still talking about an apple, it's going to be an apple. Right, okay. You don't say a elephant. That is wrong. It has to be an elephant. Or an elephant. You don't say a ice cream. It's going to be an ice cream. And likewise, okay, you will say an orange. It's not going to be a orange. Likewise, you'll see it's okay, an umbrella. It's not going to be a umbrella. So the same rule applies here. But here's okay, this and means okay means no. So does a. But we'll talk more about that when we okay get to the yes, okay, prefixes. Okay. Yes, okay, if you use a, it means okay going to be because okay, our ruled word is not going to start with a vowel, but rather it's going to start with a consonant. Okay, so that's okay. The vowels that we have in English, it's A, E, I, O, and U. Some people even go and it's okay in some instances say that Y is a vowel as well. So just think of anything that starts with the word Y. You never knew that? Okay. Well, okay, in English, you guys only have to deal with how many vowels? 1, 2, 3, 4, 5. In Danish, as okay, after U, we have 3 other vowels, which is E, Ø, O. Okay, that's good. You guys don't speak Danish. Yeah, okay, that's fine. Okay. Now, guys, is there anybody who is in doubt about sight? So if I, for instance, say as okay, neurosight, will you be able to tell me what that will be?
Did you say neurocyte?
Neurosight, yes,
Is that a nerve cell?
nerve cell. Okay, and what can be another name for a nerve cell or neurosite? Neuron. Okay, they also call them neurons. Okay. Okay, guys. That's fine. We take the emias up tomorrow. Okay, so we start with emias. Okay. But before I finish, any questions? No. Okay. Then stay warm. Well, okay, here the sun is shining. I don't know whether it is like where you are. So it's nice. Okay, yes. Go out, get some vitamin D. And But take care of yourselves, okay, guys?
Okay, thank
Okay,
you.
okay.
Thank you.
Okay,
All right, thank you.
okay, bye-bye. God bless. God bless.